One reason why couples might come in to see a fertility specialist is if they're not ovulating regularly. If you don't release an egg, it's not going to be possible to get pregnant. So we see women who don't ovulate regularly as a common cause of infertility. And in those women, we're happy to see them whenever they're ready to be seen. There is some testing that we can do to try and get an idea why women don't ovulate regularly. We can look at their thyroid. There's another hormone called prolactin. We can rule out polycystic ovary syndrome and check testosterone levels. We can make sure they have a good number of eggs and aren't perimenopausal. But for a lot of women, we still, even after that testing, aren't exactly sure why they don't ovulate regularly, although they might have some risk factors which we can't test for. Things like stress, things like exercising too much, being overweight, or being underweight. We don't have specific blood tests for those, but they can cause women not to ovulate regularly. We have a number of different ways to help women who don't ovulate. We have pills that can help stimulate the ovaries to grow an egg, or we can use injections, which will directly stimulate the ovaries to make one or more eggs that month to help women get pregnant. Oftentimes, I'm asked, what's the chances of success with our fertility treatments? Well, in women who don't ovulate, if we can just get them to release an egg, they're some of our best candidates for our fertility treatments. If you took two 20-year-olds and you told them to go to an island and get pregnant, their chances of getting pregnant that month are going to be around 20% or so. In women who don't ovulate, if we can just get them to ovulate either with these pills or with injections, they can have as high of a 20% chance per month of getting pregnant. When we get women to ovulate more than one egg, that can increase their chances of pregnancy, but can also increase the risks of twins. So when we use pills to help women ovulate, their chances of twins will be less than 10%. And when we use injections to help women ovulate, their chances of twins can be as high as 25%. The risks of more than twins also depends on whether it's pills or injections, but can range anywhere from less than 1% to 5%.